Good evening and welcome to our COVID-19 update program. I'm Neota Egbe. Here are the highlights at this hour. Nigeria advanced to third phase of the eased restriction. Curfew moved from midnight to 4 a.m. The federal government names airlines allowed into the country, vows to sanction those who bring in infected passengers. India is coming closer to surpassing Brazil's total number of cases after another 83,883 were reported. We begin today with the report that President Muhammadu Buhari has approved the third phased ease of restriction with the curfew, which is now between midnight and 4 a.m. Speaking on the changes in Abuja during the Presidential Task Force on COVID-19 briefing, which held today at the Nnamdi Azikiwe International Airport in Abuja, the Secretary to the Government of the Federation and Chairman of the PTF, Boss Mustafa, said in determining what phase of the strategy to move to, the PTF tried to balance the public health and economic considerations alongside data analysis. Mr. Mustafa said the PTF believes that while Nigeria is not ready for a full reopening of the economy, there has been sufficient progress to warrant significant further relaxation of the restrictions applied.
The Presidential Task Force today submitted its 7th interim report to Mr. President for his consideration and approval. The main thrust of the recommendation is that Nigeria advances to the third phase of eased restrictions with further amendments to address economic, socio-political, and health concerns. Mr. President has similarly considered the fact that the 6-month mandate of the Presidential Task Force would expire this month, particularly on the 17th of September, and has therefore extended the lifespan of the Presidential Task Force until the end of December 2020. The objective is to sustain a robust multi-sectoral national response to ensure that we successfully navigate the community spread stage of the pandemic, and 3, strengthen our health system and other economic and social infrastructure to enable them meet our national aspirations.
Meanwhile, the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, said former restrictions will no longer be placed on citizens of the country, while the interstate ban on road and railway travel has also been removed. Dr. Aliyu says restrictions have been lifted on stores, hotels, eateries and event centers can open for outdoor services only, while restrictions on religious centers remain as overcrowding is still prohibited. He also says the Independent Electoral Commission has been mandated to enforce the non-pharmaceutical guidelines during forthcoming governorship elections in Edo and Ondo State.
The NYSC is to consolidate on safety measures currently being put in place and start preparing for reopening of orientation camps when educational institutions open. And we are in the process of developing strict guidelines to ensure there's no outbreak of COVID-19 when this process starts. For INEC, the PTF continues to work closely with INEC. We are pleased that the last elections that were conducted in Nasarawa State, I believe, were successful. We will continue to partner closely with INEC to ensure that the election process does not pose a risk to the spread of COVID. INEC would ensure compliance with the publicized policy on conducting safe elections in the context of COVID-19, in particular the mandatory use of face mask, no voting, provision of hand sanitizers at polling units, temperature checks at polling units, and observation of physical distancing in all electoral activities. For educational institutions, which includes daycare, primary, secondary, and tertiary care, educational institutions should begin the process of working towards potentially reopening within this phase. However, we strongly recommend that states conduct risk assessment to ensure all schools are at a level of compliance and create a monitoring mechanism to assess and monitor this level of compliance. Meanwhile, all daycare and educational institutions to remain closed to in-person classes until this level of risk is assessed, and if there will be opening of schools, it must be staged and preferably carried out in phases to ensure that this does not pose a risk to the general public, and in particular to vulnerable groups that might end up getting infected by students going back home.
More on the ease of restrictions. Air France, Lufthansa, KLM, and major European airlines are restricted from flying into the country as Nigeria opens the international airports in Lagos and Abuja on the 5th of September. The Minister of Aviation, Hadi Sirika, said any approved airline which flies in a passenger with COVID-19 will be fined and will be mandated to return such a passenger to the flight's origin. But if the passenger is a Nigerian, he or she will be quarantined in the country. Mr. Sirika also said anyone planning to come into the country must have done a COVID-19 test not more than 4 days before the trip into Nigeria.
The airports will be opened. The two airports, Abuja and Lagos, will be opened for operations on the 5th of this month, as said, and we are satisfied with the preparations so far. We don't anticipate any hitches. Beginning on Saturday, for Lagos, there will be BA, Delta, Emirates, Qatar, AWA, Kenyan Airways, and Middle East Airlines. For Abuja, there will be BA, Egypt Air, Emirates, Ethiopian Airlines, AWA, Middle East Airlines, and Turkish. In our decisions, we use two items: the foreign carrier operating permit, which is a requirement by our laws for every airline, foreign airline that is operating into Nigeria, and of course the guidelines by COVID-19 task force, and then by other guidelines as restrictions that comes from other countries. Airlines will be fined $3,500 per passenger for failure to comply with the pre-boarding requirements. This is in our laws. How I wish it is higher. All intending passengers are required to register via a national payment portal online, Nigeria International Travel Portal, and the website is http://nitp.ncdc.gov.ng. So it's nitp.ncdc.gov.ng, and the pay for a repeat second PCR test to be done upon arrival in Nigeria.
And the Ogun State government, through the state's Ministry of Industry, Trade and Industry, has announced a 50% cut on the land use charges to companies to mitigate the effect of the coronavirus pandemic. The announcement was made on behalf of the government by the Commissioner for Industry, Trade and Investment during a tour of industries to assess the level of compliance with the COVID-19 safety protocols in order to reduce community spread. She said this is important to reawaken companies and need to be on the same page with the state government on safety and its efforts to flatten the curve of the pandemic, which has continued to affect lives and livelihoods. across the world.
We're not ignorant of the difficulties encountered due to the COVID-19 pandemic, which almost crumbled economic activities around the world, Nigeria included, in our effort to further cushion the effects of the pandemic. An example of this is a generous discount that is given to companies who pay the land use charge before specified dates. If you pay before the end of this month, you get a 50% discount. This was shared recently at the quarterly meeting with the Manufacturers Association of Nigeria. It is also important for me to encourage you to ensure to continuously adhere to the COVID-19 guidelines in your daily operations, as our administration is working tirelessly to drastically curtail the spread of this virus in the interest of all. I believe you already have a copy of the existing guidelines collaboratively issued by my ministry and the Ogun State Ministry of Health for all industries in our state. As you know, compliance to these guidelines is not negotiable. It is for the health and safety of your team. It is for the health and safety of all of us, because in the entire ecosystem, we all interrelate with each other.
Now, according to figures from Delta State's Ministry of Health, a total of 1,595 patients have been successfully discharged from the various treatment centers in the state. While 48 fatalities have been recorded in the state so far, it's carried out about 8,513 samples tests, and according to the government, has achieved 99% contact tracing success rate. Meanwhile, more survivors are campaigning about the coronavirus pandemic, sharing their experiences and telling the stories about how they contracted the virus and how they survived. For them, the era of doubt and uncertainty about the existence of the virus must be erased, hoping that it may help clear the doubt in the minds of the people.
That one, the period for medication was really not a pleasant one, and most importantly, it's at a point you could probably be thinking that one is dying if the symptoms, the feelings that one was getting was that you really just could not predict what is really happening. It's very unusual. Some could term it as to be malaria, but you that is going through the feeling will also, that's going through the experience, will know that this is a different ball game entirely. So it really was not a pleasant period for me at all. Shortness of breath and tightening of the chest, severe headache. There's just this feeling of restlessness, like you just restless. You just really can't, you're thinking about the tightness or losing of breath, you suddenly just feel like you're having itchy throat and all that.
In public places, to be precise, is usually much more prevalent there because of the number of people that go into such places. And so for me, I would advise that touching of objects with bare hands and then touching your nose, your eyes and all of that is not advisable at this moment. If it's even possible to wear hand gloves, is also advisable at the moment, because you really cannot tell where you contracted from.
Joining us now to look at some of the issues that have emanated from the Presidential Task Force briefing today is a public health physician, Dr. Oladapo Ashiobi. Dr. Ashiobi joins us via Skype from the Ogba area of Lagos State. Thank you for joining us, Doctor.
Thank you and good evening.
So Nigeria's third phase of eased lockdown restrictions, what's your assessment of the previous phases that were in before this recent ease?
Well, we are gradually getting into living with COVID normality. I mean, restrictions are practically all gone. I mean, from the presidential task force. And we have to learn to live with it while keeping safe, because the numbers are still rising. But I think we've turned the corner. I mean, as a nation, we can move on, but not keep our eyes off the ball and keep letting people know that it's real. And we really hope that very soon a vaccine can be discovered that will help us put a final nail on the head of COVID-19. But for now, we've done the best we can, considering the constraints of the economy, of resources, and the kind of epidemic it is worldwide. We'll just have to move on and still keep safe. That's the best we can do for now. Of course, some people will still contract it, but majority who will be symptomatic, mildly symptomatic, and those ones be followed up at home, managed, and for those who cannot, will be taken to isolation. We are not going to have many. At times, like the PTF said, is weak. I mean, it's something that is weak that you need to strengthen. So we will now have to use this opportunity to put enough resources in our health system, follow them up by evaluating it, and ensure that the people get the best of care. That's what I feel. That's what I see.
The PTF talked about restrictions that were lifted on stores, hotels. They can open, event centers can open for outdoor services. But how well do you think the risk communication is done, and the engagement with the community? How well do you think we've been doing in that area?
We've done well. The challenge is not about lack of communication. It's perception of risk. When people don't see many young people dying, many, I didn't say none, many, or the effect is largely symptomatically or mild. I'm sure you heard some of those survivors who were giving their account, like, I mean, they were either okay or just mildly ill, so a lot of people will call it malaria. Because we have a young population who really have a better immunity, and so they will do well, I mean, on a long run. So it's difficult to, most challenging thing in public health is to let people know that there's a risk when they feel well. So if you compare it with immunization, children are well. So trying to convince caregivers that they should keep them well by immunizing doesn't cut it. But the moment the child has a fever, they all run to the hospital. And so you can use that opportunity to do other things you want to do, including immunization. So see COVID in that light, that when they fall ill, maybe if you have an opportunity to now do a test and find out they have COVID, then they understand that, so what has been wrong with me may actually be COVID, not malaria. And now that the testing is a bit more accessible, but people are not taking it because they don't perceive the risk as being high.
Okay, Dr. Ashiambi, we will take a moment and we'll go on a quick break. We'll come back to look at what can we do to help people, or to help with that gap between perception and taking action, more like risk assessment. What can we do to help in that area? We'll look at that when we come back from this break. Just stay with us. Thank you for staying with us. We'll see how Dr. Ashiambi here, who we're looking at now that the government has eased the lockdown in the third phase. What is the situation? And so far, he believes the nation's done well in containing the pandemic, and so it's okay to ease up. Dr. Ashiambi, the question I wanted to ask you before we went on that break is about risk assessment. I know when you spoke earlier, you said it's a question of perception. how, when you get the information, what do you do with it? Do you have an understanding of that information you got? And then how much of it affects you or those around you? How do we move to that point where we can help the risk assessment of the Nigerians and those living within the country?
Well, continuous engagement. Now, you have to understand it's a balance of hazard, which is what causes the problem. In this case, coronavirus is the hazard. The risk is your own self-capacity to be harmed. So, our population is young. I keep saying that. So, the challenge of it being widespread and a death and hospitalization, I mean, in large numbers, didn't happen expectedly. And so, the risk is not as high. However, for every single person that is infected or affected, it's 100% risk. Some families have lost, a family of 5, imagine 2 people die. The story I'm talking about, percentages don't fly. But for a lot of people, they've not been this impacted. So communication still remains the key. Quality, accessibility, ability to pay, financial protection, equity, which are the hallmark of universal health coverage, is what we should now drive towards, so that whatever happens to our citizens, with a high level of surveillance to keep watch, then we can always take care of ourselves. So it should not be COVID focused. It should be a comprehensive health system focus. And as we are now, I know that the National Primary Healthcare Development Agency has been working with the primary healthcare system to sensitize people across all the 774 local governments, the ward, community members, patent medicine vendors. These are places we go to get care. When people are ill, they quickly go to the patent medicine vendor, otherwise known as chemist, to get the same treatment. So these people are being engaged so they could understand and know to keep safe and tell people go to the hospital, get tested, testing is available, this is the risk. And so every channel that's available, religious leaders, is what we should use to get to our people, including motor parks. So, continuous engagement. And for people to know where they go, where to go when they fall ill, irrespective of whether it is COVID or not.
All right, thank you very much. Dr. Oladapo Ashiambi is a public health physician, and he joined us via Skype from Oba. Thank you for sharing with us. Okay, so the Nigeria Center for Disease Control, NCDC, has reported 429 recoveries in the last 24 hours in 14 states, and the FCT, Enugu State, recorded the highest with 181, followed by Delta, 55, Plateau, 55, Kano, 25, Rivers, 18, Ekiti, 16, Abia, 15, Osun, 12, Bayelsa, 10, Ebonyi, 10, Edo, 10, the FCT, 10, Akwa Ibom, 6, Osun, 4, and Sokoto, 2. In the meantime, 216 new confirmed cases were registered, putting the total confirmed cases at 54,463. The virus death toll climbed to 1,027, following 4 new fatalities from Ekiti, the FCT, Ondo, and Plateau State. The 216 new cases are reported from 15 states and the FCT, with Plateau, Rivers, and Abia states leading the day's caseload. According to the COVID-19 update from Kaduna State, 11 samples that were confirmed positive were out of 116 samples analyzed for the coronavirus. The report says 10 of the new cases are from Kauru and 1 from Kaduna North, while 25 patients have recovered, putting the total number of recoveries at 2,043. 108 persons are currently on admission. The top 5 states with more cases on admission include the FCT, 3,590. Next is Lagos, 2,744. Oyo is third at 1,145, and Plateau, where we have been seeing a large number of cases in the daily updates, is managing 1,119 cases. Edo is fifth with 144 cases undergoing treatment. Nigeria's testing so far is 413,265. To expand the conversation, I'm now being joined from our Abuja studios by the chairman, Guild of Medical Laboratory Directors, FCT Abuja. Thank you for joining us.
Thank you very much.
So far, you've heard about the easing of the lockdown going into the third phase. Now, our previous guest says Nigeria's done well and it's okay to ease the restrictions. Do you agree?
Yeah, I totally agree that we've done well, and there is need to actually proceed like we have just done. But I also believe that we would have done better. Although when you compare our performance with other sister countries and some other part of the globe, you see that we are not doing badly at all. But suffice it to say that if we had done more, we would have actually gotten better results. And also, why we may be getting the reports we are getting may just be because we may not be testing so much that we needed to test. But when we go by the results we have, we can say, yes, we're doing well. So, and more so, the nature of the COVID-19 disease is not something that we will continue to lock ourselves down. We will actually systematically and gradually develop system at which we could go back to a new normal life where economic activities and some other forms of life goes ahead, even living in the presence of the virus. So I think we didn't really do so badly, but we could do much more, because if we were tested more, then maybe we may have gotten more positive cases, because I've been tracking the percentage of the positive cases vis-a-vis the total number of tests done. It's always somewhere around the 10% of the total number of tests done. So you can see that when we test more, we actually may get more positive cases. So I am thinking that there will be need for us to go ahead and not be weary or tired in testing, like what we have seen recently, that a lot of people, a lot of states are now dropping in the number of tests that have been done. We need to actually sit up, because yes, we know that we are easing the lockdown, but totally the danger is not yet out. The danger is still here. So we should be cautious of that and still go ahead to test and test and test. So it's when we test high volumes and we get high volumes of negatives, then that's the time we can beat our chest and say, yes, we have done well. So I think we've not done badly, but we can do better.
We have a little over 413,000 tests that have already been done. How do you think we can do more tests if people are not going to the testing centers? Are you looking at mass testing at once?
Okay, there are ways actually we can do that. First of all, the system we are adopting already is not bad, but we can expand it such that if we can localize these testings to all the primary health centers or all the public hospitals, that will actually help people to actually get tested. And that is because some of them, when they do present in the hospital with symptoms, and you find out that you now refer them to go and test, some of them will actually lose in transit. They may not actually want to go to wherever you have sent them to go and test. So in that case, we now lose those people for testing, excuse me. So, but apart from that, another thing is that the perception. A lot of people feel that there's a lot of stigma around it, that we actually need to encourage people more to understand that there is nothing wrong in actually testing for COVID. Even because like in my facility, I see people who present with lots of symptoms of COVID, and you tell them, go and test, and they'll tell you, no, it's not my portion, and a whole lot of things like that. And they will go back like that, will not know whether they really have the virus. If they do, they may be sharing it. So I'm thinking that, the system has to be expanded. Then another thing that we might do is actually to encourage actually do more for the private sector to actually do this testing. I'm aware that the government is doing a lot good, to bring the private sector on board, screening them and maintaining standards and selecting the people that actually qualify. But the setting up of these labs is not actually on a cheap side, because a lot of people will prefer to go to private facility. I received a few calls today about some people who don't want to go through the stress of governmental process, but they want actually to do testing. So, but they want private laboratory where they could test. So, if government or public-spirited individuals could actually support the private sector to actually provide these testings at a reduced or no cost, that would actually help so that people can easily walk into those laboratories and actually get tested. I'm aware that the CBN actually rolled out an intervention fund that could actually help the private sector to set up those laboratories. But the problem there is that the condition that they gave, that 20% of your total annual income. Now, to set up a PCR lab is in hundreds of millions, and when that, for you to get a health facility in Nigeria whose annual average, 20% of annual income is to that tone, is really, really very rare to get. So that makes that provision very clause actually makes it difficult for those health facilities to assess the tone of the fund that will actually encourage more people to actually set up the labs. So if the CBN can look at that very condition and see how they can reduce it to encourage more laboratories to come and take the funds, then more laboratories will be set up and access to testing will be high, and people, then we can test more, because definitely, over 60% of Nigerians patronize private, and because they do that, there is know-how that we can test so much if we remain on using only public facilities. So that's the way I think we can actually test and test more.
Okay, let's look at this matter of the international flights that are resuming on September 5. How vulnerable will the country be in terms of the possibility of importing more cases or new strains of the virus?
Based on the conditions that have been provided, I think we are somehow protected, because that's like a double barrel checks. Those people are going to be checked before they board to Nigeria, and the standard of the testing was also made clear. It's not just that they were tested for COVID, but they specified a type of testing that will be done, and that is the PCR testing. Because some people or some countries go ahead and use the rapid diagnostic testing, which is not even validated in Nigeria because of its poor sensitivity and erroneous result. Those countries use that, and because of that, it could give us a bad, it could actually pass some people who actually have COVID. But when they use actually PCR testing to test over there before the person boards, when the person arrives Nigeria, according to the guidelines led by the aviation ministry, the person is quarantined, forced quarantine, and after which the person will also be tested again with the same PCR system to confirm what the other country that the left has actually done. And I think with this, somehow we could say that we are comfortable, and it might be really difficult to actually get cases that will escape. Because when the person comes here, assuming they missed it out the other time because for one reason or the other, when the person comes here, the person is kept on quarantine between 8 to 14 days so that the incubation period must have reached, and after which the person is tested. If the person is certified, okay, I think there is no fear. There may not likely be any fear that they may import cases to Nigeria. So I am thinking the Ministry of Aviation has done thorough job.
Thank you. Mr. Ikechukwu Ononuju is the chairman of the Guild of Medical Laboratory Directors, FCT Abuja. Thank you for sharing this evening with us. Now, ahead of the National Common Entrance Examination scheduled to hold in October this year, primary schools in Niger State are getting prepared to reopen for pupils in exit classes. To ensure their safety and that of the entire school community, the State's Universal Basic Education Board organized a training for head teachers who are expected to turn their staff into their own training. Our correspondent, Emperor Simon, tells us more.
Over 3,000 schools across Niger State are expected to reopen for primary 6 pupils that will be writing the Common Entrance Examination. The training organized by the Niger State Universal Basic Education Board is to equip head teachers and other participants with the requisite knowledge on how to protect themselves and, more importantly, the pupils that will be resuming. The chairman of the board says that if the school administrators will adhere strictly to the laid-down protocol, then the entire school will be safe.
The training is all about preparedness for the opening of our primary 6 exit class for examination purpose, school resumption, and ensuring that we take into cognizance the COVID-19 protocol in opening our school.
Among the things that the participants are trained on is the use of face mask and washing of hands, as well as how to handle emergency case when it occurs.
You have to provide material, enough material to avoid sharing, even these books. Don't say, well, we have only one textbook by 4 learners. Would mean they have to come together very close to each other, and from there one of you may sneeze, and that is the beginning of the crisis.
Niger State currently has a total of 243 confirmed positive cases of COVID-19, and the death toll still remains 12. From Niger State, Emperor Simon for COVID-19 updates.
Kwara State lifted the ban on non-contact sports, but athletes have begun training in preparations for upcoming competitions. While appreciating the government for the lifting of the ban, the athletes appealed to the authorities in the state to provide sporting equipment and renovations of a stadium for optimal performance.
As though waiting for the announcement on the lifting of the ban on non-contact sports, athletes have started thronging the Kwara State Stadium to resume training. And activities are already going on inside the indoor sports hall. Table tennis players, both young and old, and physically challenged, are busy training. They expressed satisfaction with the lifting of the ban, having stayed home for the past 6 months.
For like 6 months now that we have been at home, some of us have turned to grandma and some of us have turned to grandpa, so I feel so happy.
These physically challenged athletes appeal for more support.
Being a physically challenged doesn't mean that I can't do anything that everybody is doing. But I want the federal government to assist us in terms of the apparatus we are using, that is the equipment we are using, like the bats, the ball, the table tennis, and the net, and everything that will make our sport very effective and very efficiency.
For the coach, priority should be given to the renovation of the hall. The facility was usually used for the hosting of the national table tennis competition, but today it lacks all the trappings.
We are calling on the executive, the sport-loving governor, to please come to the aid of the Kwara State Sports Council to rebuild, to reconstruct the stadium indoor sports hall.
The request of the athletes, according to the Director of Sports, will soon materialize as the state governor has been briefed.
With just a little time, everything will be okay.
Many people involved in contact sports are also appealing to the government to lift the ban on their sports as soon as possible.
Well, in Kaduna State, non-contact sports, the ban on non-contact sports has also been lifted, and it was suspended in March 2020 by the government as one of the restrictions to stop the spread of the disease. The Kaduna State Commissioner for Sport and Youth Development, Professor Kabir Mato, told Channels Television that golf courses, table tennis, and other non-contact sporting activities have been reopened with strict adherence to safety protocols. According to him, contact sporting activities such as football and basketball still remain suspended till further notice.
The Ministry of Sports Development, in conjunction with Business Innovation and Technology, have come up with protocols. But as you know, the protocols in each of these non-contact sports will differ. For instance, the protocols that you have for people who are going to play golf will differ from the protocols that you will have for cycling. So we have drawn all these protocols and we have submitted them to the respective associations, and I assure you that they are back, they are playing. For instance, one of the major items, the protocol list, is the fact that for all those events and activities that normally have clubhouses, where clubhouses are not allowed to open, because contacts become very easy when clubhouses are open. People may wish to recreate. Still, the ban on these, meetings is still in force, and we are hopeful that by the time the federal government, through the NDDC and other, the Presidential Task Force Committee on COVID-19, by the time that they will come to the realization that it is safe enough to lift the ban on other sporting activities, that is even contact sports, then of course Kaduna State will also consider the possibilities of doing that, and we will resume. But as it remains today, team events like football, basketball, volleyball, and the rest of them are still outlawed. They are still banned until further notice. But like I said, non-contact sports, all the non-contact sports are allowed to resume, but observing very strictly the protocols that have been drawn by this ministry in conjunction with the Ministry of Business Innovation and Technology and approved by the COVID-19 task force in the state, which is chaired by the Deputy Governor.
Now, globally, there have been more than 26 million confirmed cases since the outbreak began and 863,000 deaths. India has come closer to surpassing Brazil's total number of infections after another 83,883 were reported. India has confirmed 3.85 million cases, just 100,000 behind Brazil, the world's second most affected nation. Meanwhile, at least 7,000 health workers around the world have died from the coronavirus, with the highest country toll in Mexico, that's according to a report by Amnesty International. Here's the global update.
Concerns in the United States are also heightened by the fact that the number of COVID-19 cases has reached 6.11 million as at early today. The nationwide caseload amounted to 6,111,485, with the death toll reaching 185,669. Meanwhile, new data from the Labour Department shows the number of those registering as unemployed fell by more than expected last week. The U.S. economy has taken a big hit since the pandemic, with struggling businesses shedding workers to try to stay afloat. And in Spain, the unemployment minister says the country's furlough scheme will be extended for as long as is necessary. This comes as thousands of teachers undergo COVID-19 tests in Madrid, days before a fresh academic year begins in the country. Tests had to be stopped on Wednesday after the centres assigned to perform it were overwhelmed by thousands of teachers that found themselves queuing for hours and unable to comply without social distance. Meanwhile, testing centres in Paris are ramping up operations this week in an effort to reach the target 1 million tests per week in the country. The new target comes as the number of coronavirus cases in France continues to rise. As of Wednesday, there were over 7,017 new confirmed coronavirus cases. The country now has more than 293,000 cases of coronavirus. Finally, teachers have been welcoming back pupils to schools in the UK, alongside making significant changes to help keep children safe. Hand washing tutorials, separated equipment and reconfigured seating systems are methods being applied in schools, as well as pupils being kept in smaller groups, controlling where they walk in communal areas and requiring the provision of water bottles and pencil cases to prevent sharing.
That's fine.
That's our package on COVID-19 update program for tonight. You can take a closer look at some of the COVID-19 global numbers in real time. Visit our website, channelstv.com. There you'll get more updates and better understanding of all you need to do to stay safe during this period. And of course, there are other stories on politics, business, and sport. To join us for fresh packages of the program tomorrow at noon, 6 p.m. and 9 p.m. Thank you very much for watching. I'm Neo Taigwe. Do have a good evening.